Okay, the senior member would like to call the Justice Committee to order on this Tuesday, October 6, 2024. If Chairman Erickson and Vice Chair Bell are not here today, so unless there's any objection, the senior member will continue chairing the meeting. Any objection? Okay, thank you. So we have members Schaefer, Abraham, Roseman Mendoza, and Chair Metzger. And so we do have a quorum. We do not have many members of the public. And moving on to number 3 is a consent agenda. Do I have a motion? Motion by Abraham, second by Mendoza. Any discussion? Hearing none, we'll be voting on the consent agenda. All in favor, say aye, and the chair will vote. Aye. Any opposed? Okay, moving on to departmental matters. First up is Matt Lane, Sheriff.
Good evening. I didn't have anything on the agenda tonight. I was going to give my stats unless anybody had any other questions about what you've received in your packet.
What about the numbers?
I was going to give those. I just didn't know if there's any other business anybody wanted to talk about.
Okay, I didn't have any.
So I do have mental health numbers are as follows. I have 9 unfit to stand trial in custody right now and 3 not guilty by reason of insanity. We have 8 more pending fitness evaluations. There's not been much speed up with the Department of Human Services and getting people in. Just a limited amount of bed space at this point still. IDOC, we're holding 7 parole violators right now that used to be taken back into DOC custody and are now left in our custody until their cases are final. Have a final disposition, which is quite a long time. So other than that, I wanted to make an introduction of our new corrections officer, Daisy. She's laying over here. She's kind of lazy. Daisy is this is Lieutenant Proctor. He is Daisy's handler, and he is about a month away from being fully certified as her handler for a facility dog. We got on a list a very long time ago for an eligible dog that finally came available. She's been a very good fit. She is a facility dog, so she will go into the detention facility. She has helped calm many inmates already and gain cooperation in many circumstances. She's kind of a pick-me-up for the employees too. So she's been over here to the admin office once. She goes everywhere with Lieutenant Proctor. He has kindly pretty much donated a lot of his time to be certified as a handler in the evenings. So we do owe him a lot of appreciation for that, because she has turned out to be, she's already been working with him every day. She does everything with him, and she's been a success already. So I wanted to introduce her, and then in September, Lieutenant Proctor will be certified as her handler, and it'll be more official, but I wanted to introduce her to y'all today. So.
Thank you. Any questions, any comments? She's a real sweetie.
She is. I've talked to her about her shedding and keeping it under control, but she doesn't seem to be wanting to listen, so.
Yeah, it's kind of nice to see that, because a lot of service dogs you're not supposed to touch.
Right.
And this is one that
She is for touching.
you want to touch, yeah. So,
She's for hugs and petting, and it's working out very well at this point.
yeah, good. I'm glad to hear that. Thank you.
Thank you.
Anyone else have anything from Sheriff Lane? Okay, thank you. Moving on, next up is Kathy Yoder, coroner. Hi there.
Hi, I have nothing to report, but you can ask me anything.
Okay. Any questions for? I have a question. I think we've read articles about increases of opioid deaths. Or
I saw that from GLT too, and I'm going to have to look at that data because I don't know if that's correct data.
okay. Thank you for that.
Or where they obtained that data.
Thank you for that clarification. Anyone else? Chair Metzger.
I just wanted to acknowledge one of your staff members. I think he was Dr. Dr. Denton was acknowledged for his can't remember exactly. It was,
Dr. Denton got an award from Gift of Hope at a Corners conference that we did at Rob Dobbs.
thank
that
you.
McLean County hosted.
And I think that's important that we acknowledge his efforts and the fact that other people recognize that. So
Yeah, thank you.
please
He does
tell
do a
him
lot.
congratulations from us.
I will definitely do that, thank you.
Anyone else? Okay, thank you. Next is Ron Lewis, Public Defender.
I only have monthly statistics, but other than that, available for questions. Thank you.
Okay, any comments, questions for Mr. Lewis? Okay, thank you. Next is Will Scanlon for Circuit Court, but we have Judge Rebecca Foley with us, and there's one item for action. Request approval of an Illinois Supreme Court Access to Justice Improvement Grant. And I need a motion for that, please. Motion by Roseman Mendoza, second by Abraham. Do you want to explain that, please?
I was not sent here to cover that item, so I am not prepared to explain it. I apologize.
Okay.
I'm here on the second item, request approval of travel vouchers.
Okay. Okay, thank you.
With permission of the chair, I would just add that this is an Access to Justice grant that is on page 13 of your packet. And this is to help with those citizens that are facing a language barrier in our court system. I believe this is not the first time we've received this grant, and so it's a repeat grant, but you have the documents included to show the accurate amounts for this year.
Any questions? Mr. Abraham?
I'm seeing that there's just the 3 iPads, and then there's a couple other things that are meant to kind of further the iPads, like accessories and everything. Is this enough to combat the language barrier? I'm not sure how many non-English speaking people there are at the courthouse.
So that varies from case to case. However, this is not the totality of the services that we provide for language services. This would just be included for what is in this grant. So I know that they do use local resources for interpreters at Western Avenue. They also have a language line that has every language you can think of included on the language line. And they have sign language interpreters that come into the courthouse when needed. So these services are just specific to what they can accompany or account for from the grant.
Any other questions? Hearing none, we're going to be voting on the Illinois Supreme Court Access to Justice Improvement Grant. All in favor, please say aye. Aye. Any opposed? Okay, that is approved. The other item is request approval of travel vouchers, which is also in your packet on 21 through 45. If you have something to say about that.
Sure, I'd just like to address, I'm sorry?
You need a motion first. Motion by Abraham, second by Roseman Mendoza. Now you can go.
Thank you, my apologies. I just wanted to respond to Ms. Anderson's memo that was presented to the Justice Committee on, looks like August the 6th. By way of explanation, Ms. Stiegel is a relatively new hire to the county. She did come from court services, but she fills a newly created role of Family Treatment Court Coordinator. I don't know how much background you want, but the Family Treatment Court is a problem-solving court designed for parents who are in the juvenile abuse and neglect court system who have substance use issues. So it's kind of like drug court for those particular families. We hope to be the first certified in the state of Illinois. So when planning for the National Drug Court Conference in May, Ms. Stiegel reached out to Court Services because they had many people who were also going, and they had booked travel through Peoria Charter. Because she's not an employee of Court Services, they weren't necessarily going to book her travel for her, so she also reached out to Peoria Charter. I will acknowledge she was not provided with the county policy on travel, and the court does take responsibility for that. So she looked at the cost of the flight only, not recognizing that her mileage as well as parking would be added to then put her over the lower limit threshold for the direct flight. So acknowledging that was a mistake and it will not be occurring moving forward. I would like to add that these expenses are covered by a grant we have received from the Administrative Office of the Illinois Courts. We had specifically included this conference in our budget. We had received permission to send 4 persons to the conference. We only sent 3, so I think we're well within that budget and have some flexibility there. So all these expenses, we anticipate, will be reimbursed through that budget. I'm happy to answer any questions.
Any questions from the committee? Hearing none, we will be voting on approving the travel vouchers that were submitted. All in favor, please say aye. Aye. Any opposed? Okay, no, thank you. I don't think you're going to say anything else about Will, unless you have any information you would like to share with the committee on Will's behalf. Okay. Okay. Thank you. Moving on, next up is Suzanne Montoya, Court Services Director. And you have no items for action.
No, just the standard monthly statistics, but I'm happy to answer any questions.
Any questions? Graduations coming up?
No, we don't have any scheduled as of right now.
I was asked that about a month or so ago, and I haven't heard any. So thank you.
I will keep you updated as to when our next ones are.
I just got to make sure I check. Okay, thank you. Next is Erica Reynolds, State's Attorney. And you have no items for action.
Correct, but I'm available for questions.
Any questions for the State's Attorney? No? Hearing none. Is there anything else you'd like to say?
No, thank you.
Okay. Okay, next is Don Everhart, McLean County Circuit Clerk, and he is not here. Okay, and he did not have any items for action and just his monthly reports, so if you have questions on that, please contact the administrator. Number H is Eileen Vega from the Children's Advocacy Center Director. Welcome.
Thank you.
And you have one item for action.
I do.
And that is a request approval of Violent Crimes Victim Assistant Program Grant Agreement between the Illinois Office of Attorney General and McLean County CASA Grant Number 251065. I have a motion. Motion by Abraham, second by Roseman Mendoza.
This is a continuation grant from the AG office to fund salary and fringe benefits for staff members of the CASA program.
Okay. Any questions from the committee? Hearing none. All in favor of approving the, is that a VOCA grant?
AG.
Okay, AG, okay, AG grant. And McLean County CASA, say aye. Aye. Any opposed? Okay. Hang on a sec. So you have your monthly reports for items for information. This is your first meeting, so you want to give us maybe a little introduction?
Absolutely. I'm Eileen Pagan Vega. This is my 4th week with the county. Very happy to be here. Originally from Puerto Rico, I moved here to McLean County, specifically Bloomington, 15 months ago with my spouse and our daughter. In Detroit, I worked for Detroit Public Schools Community District, and I served as the Assistant Director of School Operations during my tenure there. And this is my first professional experience in Bloomington, and so far I'm enjoying it. Thank you for having me.
Welcome.
Thanks.
Thank you. Anything else you want to say about CAC?
Any questions for me? I've just been meeting the staff, getting to know them, sitting, observing interviews, meeting our stakeholders that we work with, including law enforcement, our fundraising board, CPN, and just trying to get acquainted with all the grants and all the reports and.
And you start right at budget time. Walk right into
That's-
budget.
Yep, that's right.
Well, welcome again. Thank you.
Thank you.
Next, we have Metcom, Rhonda Flagel, and you don't have any items for action, but we're going to get a wonderful presentation about CESA with Megan Mosier.
Absolutely.
Okay. Hello? Oh, yeah, it is. Okay.
You're less nervous now. So we just want to come here today to give a little update on CESA in McLean County, what you guys should know. Again, I'm the director for Metcom, Rhonda Flagel. This is my-
And I manage our crisis team for McLean County.
We also serve as the Region 2 representatives on the Regional Area Committee
Yes.
for CESA, along with Chief Jamal Symington. Next, there we go. So we've been serving on your Regional Advisory Committee since 2022, about. We attend regular meetings. Currently, they're on hold while they re-envision. So we did hold a hyper-local meeting in McLean County on July 11th, where we had 26 attendees from police, fire, EMS, hospitals, and our mental health providers around McLean County. So what is our Regional Advisory Committee? It's going to be the pre-existing EMS Medical Directors Committee structure under the IDPH 11 EMS regions that are charged with the development of regional best practices and protocols consistent with realities of the locale. The RACs consist of the following appointments. There's representatives from 911 PSAPs in the region, representatives from the EMS Medical Directors Committee, also law enforcement, EMS providers, provider unions, mental health and behavioral health providers, and then along with advocates from the mental health, behavioral health, intellectual disability, and developmental disability communities, the majority of whom either have lived, experienced, or from organizations composed of such individuals. So the three of us sit on that committee for Region 2, which covers McLean County, adjoining counties. There's
All the way up to Peoria, kind of up through the Quad Cities and stuff. So it was varied on the people that are in that committee and what services they have.
a little background on CESA. CESA stands for the Community Emergency Services and Support Act. It's a new legislation, not so new anymore, that requires emergency response operators such as those in 911 centers to refer calls seeking mental and behavioral health support to a new service that can dispatch a team of mental health professionals instead of police. It's going to be a significant change in policy, and the implementation details for this new law have been tasked to the Secretary of Department of Human Services, who will work in concert with the 911 administrator, who's with ISP, the EMS administrators, and the statewide regional advisory committees. So the state advisory committee is who the RACs answer to. So we meet and have our own meetings on local level, and then they report to the state level. More of ideas, thoughts, not so much, we don't get to make decisions about it. We can give them our thoughts on what they're proposing on the legislation, but we don't actually get to make the changes. That has to go to the state level for them to make those changes.
Which is good because of the fact that varied throughout the state, there's different types of things that we would find important in our area versus maybe Chicago or something like that.
For this new legislation to work, the systems all have to work together. We're very fortunate in McLean County that we already do that really well. But that's another reason why we held the hyper-local meeting with our responders and with 988, PATH, Behavioral Health Services, just to kind of bring everybody together and get them on the same page as to what's going to be coming within the next year. So this, when it started in 2022, the original date was July 1st of 2023. It then got extended to July 1st of 2024. That's coming past, and the new date is July 1st of 2025 that they are trying to get this implemented by. As I said, they kind of put our local meetings on hold to do re-envisioning meetings, and also to suggest that you go back to your communities and hold the hyper-local meetings at a smaller scale, because what they were finding is that it's not one size fits all throughout the state. The communities are of vastly different sizes, cannot accommodate everything that they're requesting on the, it's called a risk level matrix, and it has 4 levels, basically on how the degree of the call types of the, with the mental health patients, and how they would like to see those responded to.
Essentially what we found was we were spending more time sort of, I wouldn't say arguing, I would say having a discussion often about the differences in each of our communities, and how different they were versus actually making progress in what would we do in our community. How would we take the information that we know we need to do and then put it into what our community does or doesn't have. And so I think that's what they're re-envisioning, is realizing that just us trying to talk, even for as big as our region is, of how this is going to work isn't going to make any sense, because we would have to make it more hyper-local so that we can kind of decide in our community, what do we want this to look like, while adhering to the rules of the risk matrix and of the law in general. So.
What we found is that it has different, CESA is going to mean different things for our providers in McLean County. No procedural changes are going to take effect until those protocols and standards are fully approved by the governing bodies. So right now, everything is status quo. We're still doing the same things that we've done previously, and everybody will be fully trained. So I know, like, our staff for METCOM 911, I've been sending them to the CIT course for specifically for 911 personnel, in order to gear up for the fact that that will be mandated eventually. This way we're just ahead of it. So the changes that the legislation is going to require in Illinois: PSAPs, Public Safety Answering Points, must coordinate with mobile crisis response teams. DMH has developed through its program 590 to provide a community-based response to low-level and low-risk behavioral health crises. Coordination will be required across the 180 different 911 PSAPs in the state and dispatched emergency service providers, along with, is that 68 or 88? Sorry.
68.
Thank you, I can't see that far. Mobile crisis team program grantees. So mobile crisis response can be dispatched whether it's 988 or 911 is called. Specified training will be required for all DMH responders and 911 dispatchers. Regional best practices will be developed by the RAC consistent with the physical realities of various locations. And law enforcement must be integrated into that process so that the individuals involved with low-level nonviolent misdemeanors can be diverted to the mental health system. Let Megan take over.
Okay, so luckily, as I say on there, we have had a mobile crisis team for an extremely long period of time. We have been ahead of our time when it comes to that, which is both a good thing and a bad thing. A good thing because of the fact that we already had infrastructure in place and funding somewhat in place to be able to support a mobile crisis team and what all that means. The other side of it is we have already been integrated into our community in such a way that it is not ready necessarily for the additional things that we are going to need to do in order to make the requirements with this new legislation. And part of that being a couple different things. Some of it is just all the different areas within the community that we go to. McLean County is one of the largest counties if you look at like just space and land, getting to different places. In some other areas, they actually have like multiple counties because they're more rural versus, and so they already are gonna have their own problems trying to adhere to. This new legislation for us, our issue is that our county is very big in general. So some of the timeframes they're going to want is just not realistic to what we will be able to do because we are one entity within the entire county. The other thing is what we get used to provide services for. So for example, we provide services in our area hospitals. We provide services pretty much in multiple different locations and have for many, many years. But that's going to need to change based on the fact that we will need to be able to try to make some of the timeframes that would be in this risk matrix. So what we've tried to do to get ahead of it is I have had meetings for the last couple years with our area hospitals explaining that we always have prioritized community calls versus hospital calls. I would say when COVID happened, for the most part, people didn't really want us out at their houses and things, so we didn't have as many community calls. Law enforcement wasn't bringing us out as often. So it really has been, our response has been primarily in the hospitals because of the fact that that's where everybody goes in order to seek services. With this gives the opportunity for us to be out in the community. However, with the timeframes they have and with the amount of people that are still choosing to go to the hospitals, we are looking at we're currently looking at extremely long wait times. It's going to only go up. And so that's going to be a very difficult adjustment, I think, based on the staffing that we have. Unfortunately, the state of Illinois decided to do this and then not pay us enough to be able to do it. So in our area, what is nice is we get funding from multiple different funding streams, and we just had a conference not too long ago in which they were encouraging us to find funding streams for this because other mobile crisis teams are struggling to be able to be 24/7, to be able to do any kind of response that they're looking for. And as we all know in McLean County, law enforcement is not going to look to you to help in certain things if you have to say no every single time that they ask for a response. And so many other areas are not even up to the standards they're looking for. We are minimally up to the standards. We actually still aren't fully up to the standards because partially it's for hiring and partially it's just because we don't have enough staff with our funding currently. So we're working right now to figure out how to adjust our staffing to try to at least minimally cover what we can. As you can see, we did meet with our area hospitals to let them know their wait times will go up, so at least they're aware that that will happen. We've done a lot of education with anyone within the community that will be affected. So most of the time it's the hospitals, but it could be the hospitals, it could be the jail, it could be anywhere safe that somebody's waiting, that they may have to wait longer if we have to also add this in to something that we need to go out on. We've worked towards recruiting and hiring staff. This has been a statewide shortage. At our conference, they did specific things in which they're looking to lower some expectations and educational requirements for crisis staff because they are realizing that it is very hard to keep employed and recruiting crisis staff just because it's such a stressful position in and of itself. So they're looking to try to help with that, but that is something that is very, very difficult for most areas. Luckily for us, I am fully staffed right at this moment, well, almost fully staffed right at this moment, which is nice. But we've been working on that, and then we work to really try to help prepare our staff for understanding how to triage multiple calls that are going to come in at once. For the most part, we have run as a team in which one thing waits for the next thing, waits for the next thing, waits for the next thing. This is going to be a mixture because we know that there are people waiting in a queue in multiple different areas, and so we're going to have to train how to get to where we need to get to in the correct amount of time. With the risk matrix that you talked about, the two timeframes are 30 minutes and 60 minutes. And so 30 minutes is going to be extremely difficult for us to do. 60 minutes more likely, but it's going to be definitely an adjustment to figure out how to fit that in. So those are some of the things we've been doing. And I can't remember if I'm the next slide as well. Oh.
I don't think so.
Nope, that's it.
Just a little bit of the legislation. I won't read it all the way through. The most important part is highlighted in red. It is necessary and in the public interest to provide emergency response with or without medical transport to individuals requiring mental health or behavioral health services in a manner that is substantially equivalent to the response already provided to individuals who require emergency physical health care. So that is the intent of the legislation. If you want to move to the next slide. There are a few state prohibitions that kind of cover everybody too. The law enforcement responsibility for providing mental and behavioral health care in any area where mobile mental health relief providers are available for dispatch, which McLean County we do. Law enforcement shall not be dispatched to respond to an individual requiring mental or behavioral health care unless that individual is involved in a suspected violation of the criminal laws of the state or presents a threat of physical injury to self or others. That's kind of more where the risk matrix come in. I did not share that today only because it's a very ever-evolving document and they don't want it necessarily shared with public right now. It is on their website, so people can go look at it. I just didn't print it out. Several pages if you wanted to look at it. Mobile mental health relief providers are not considered available for dispatch under the section if 988 reports that it cannot dispatch appropriate service within the maximum response times established by each regional area advisory committee. We did have some 988 and PATH representatives at our hyperlocal meeting. They were very responsive to what we had to say. They had good things to say after the meeting, and kind of getting a better understanding for which each of us does. We have asked them and invited them to come sit alongside a 911 dispatch so they can kind of see our part of things, and maybe teach us that some of those calls don't necessarily have to be sent out police or ambulance, more that maybe we can increase the amount of calls that we're transferring to 988, which is part of the goal as well for the legislation. Just another cover that law enforcement shall not be used to provide transportation to access mental or behavioral health care or travel between mental or behavioral health care providers. So currently and in the past, it has not been unheard of that if police were to respond to a call and they didn't necessarily want to take an ambulance, the officer themselves would transport in their squad. So that is not going to be allowed anymore unless there is no other alternative available. As far as the PSAPs go, there's 3 conditions as well for the 911 centers. That they're dispatched through a 911 PSAP, coordination of activities with mobile and behavioral health services. Emergency services dispatched through the PSAP must begin coordinating its activities with the mobile, mental, and behavioral health services established by the Division of Mental Health. Once all of the 3 of the following conditions are met, they're saying currently at the deadline of July 1st, 2025. So those conditions being that the statewide committee has negotiated useful protocols. They are working with the protocol vendor. So 911, we use what's called EMD, Emergency Medical Dispatch, as our protocols. It is a set of guide cards that the dispatcher reads once they find out what the medical emergency is. They read those questions through. It gives the determinant of the response level that needs to go. So they are working to integrate a new protocol for first-party mental health callers suffering from a mental health crisis, as well as not adding a new one, but modifying the current mental health or behavioral health card that is already in existence to change those questions a little bit to further triage and decide on a dispatch. The second one, the appropriate regional advisory committee has completed design of the specific 911 PSAPs process, coordinating activities with the mobile mental and behavioral health services. And the third being the mobile mental and behavioral health services is available in their jurisdiction, which ours is. So currently we're working on 2 of those 3. I believe that's it, unless anybody has any questions we can try and answer for you.
So basically on that last one, the main thing is that they don't want to worry people that something would start without there being like everything set in place so that it will go smoothly. So that's why they're really pushing us to make that July 2025 deadline. They're really pushing us to make sure we have vetted out some of these other things because they cannot go live with everything and make it mandatory until those three things have happened. And so because they realized it was taking too long to do that on the region level, they're now saying, make sure that you can do these three things, and then you're gonna be able to go live in your area. We are in the process of doing a pilot, probably quicker than I would probably like, but whatever, we're good in McLean County. They wanna do a pilot as soon as possible because we have an existing mobile crisis team. So we're on board to do that. We're fine with trying it. A lot of it has to do with the questions being prepared. Our Priority 1 dispatch is not the one that was picked by the state to start to pilot, and so they're working to try to see if they can also do other pilot projects without the specific dispatch area that they sort of approved already, if that makes sense. So we don't have the right program that they approved, but they're hoping to be able to get this other one approved so that we can at least pilot it and see if this works.
Questions from the committee? Chair Metzger.
I was just wondering, you were talking about how those timelines, those response times have been shortened. And I'm curious as to who will be policing that.
So the state of Illinois wants to work to have a system in which they can police it. This is one of those things that our county is pretty good, if not great, at our data collection. So a lot of mobile crisis teams are not set up to collect data on their response times in the way that they're looking for. So the state had come up with ideas such as trackers in people's cars to see how quickly they got to somewhere. Obviously, there's no money for that. So they've realized they can't do that. So now they're gonna rely on the data that we collect within our own agencies to say how quickly from, when we were told to go, did we actually get somewhere? And so the state is working on how they would like to collect all of that data to see if we're even able to get to the places as quickly as they want us to.
Other questions? I just want to say, Megan, we've been working on this for long before CESA became a law. And I've been sitting in on a lot of the meetings too, and on the data that Chair Metzger mentioned, they're looking at trying to how they're going to do that, and they have things they want to track and metrics and stuff like that. But I want to also repeat what you said, that McLean County is very progressive in this area. We have been for many years, and that we do have these relationships that have been built between, different agencies, as compared to some of the meetings when I hear that, we've never talked to our PSAP, we have no clue as to who they even are, kind of thing. So I think that is really a good look on McLean County. And so much of this falls into the Mental Health Action Plan and some of the things that we've had set for goals for many years. And I guess we have laws that now are kind of forcing us to do some of these things, which is good, except that it's an unfunded mandate. I mean, everything is an unfunded mandate for all of these things, which is great. And then I just want to also mention on Behavioral Health Coordinating Council, we set some priorities, and a couple of the priorities were workforce, which is one of the issues that you had brought up, Megan, and also marketing on services so that people don't go to the ED, so that they know what other services are available in the community to call mobile crisis versus go to the ED. So I think that there's a real good opportunity to continue to work together to move McLean County forward way ahead of the state. Because like I said, I've talked to them. I've been on the data committee and been part of that for the last couple of years, so.
So I think the biggest thing to stress is the fact that we will have a very difficult time because of the fact that it's an unfunded mandate. So, we asked for a certain amount. We didn't even get what we asked for out of it. And so, there's going to be that middle area where people hopefully will eventually learn not to go to the emergency room, but right now they are. And so when you're looking at us not being able to respond in the right amount of time to law enforcement, we're going to end up saying no far more likely than yes. And I think that's going to be very difficult with some of this. So I think just to stress, because one thing law enforcement's gonna have to do possibly is wait until we can get there. So you're holding up an officer for 30 minutes or more, waiting on us to get there, which is not going to make them very happy. So it is definitely something to where we want to do our best, you know, with this, but we want to make sure to stress that right now, the way we're funded, it's not enough in our area to give the kind of response that I think everybody would really love to be able to give.
Correct. And there's also another group legislation that is actually having to look at the cost of what CESA is going to cost and to fully fund mobile crisis or whatever it's going to cost for the PSAPs to change their whatever and all those, that kind of thing. So that group is also meeting. I think they just put out one of their first reports on the GA. So that will, and they have a deadline, I think, of October.
Well, they're gonna have to have something, because that's the biggest thing that, when we went to our conference, that all the 590 programs pushed back on, was the fact that we're just not funded enough to do what they're asking us to do. So they asked us to go to our communities and ask for more money. But as you guys all know, and we all know, there is not just extra money floating around for, you know, the different things. So they talked about how do they call it, a corded funding
Braided.
approach?
Braided.
Or braided, yeah, there you go. It was a braided funding approach, you know, ask for money from your county, ask for money, you know, from different places, which makes sense. That's what we've already done in our county to a point. But I think this is just, especially once they started doing timeframes that are gonna be tough, you know, for some areas, more difficult for some areas than our area, but still tough. I think those are some things they're really gonna have to look at sooner than later, because they're gonna want the right type of response, I think, to this.
But hopefully the legislators will realize, hey, we got to pay for this. If we pass this legislation and we got to pay for it now. So we'll see what happens on that one. Thank you very much. Chair Metzger.
Anybody else? Member Schaefer and I were in a meeting earlier today, and we were informed that the Attorney General is looking at unfunded mandates
For the schools.
for the schools. So
Through education.
I'm curious as to whether that is going to move into other areas. Have you heard anything of that nature?
No, unfortunately, like we were saying, we haven't actually even had a meeting for
They had to stop everything.
several months. They keep getting canceled. So I'm hoping we'll have a better update. They're looking to reconvene in September.
We're very interested to see what their new direction is gonna be, because I think they realize that some of this is gonna be tough to roll out if they really want it to be by July of 2025 without funding and some other things.
Well, and they're also looking at the Arizona model, which took them 30 years to get to where they're at. So, and they wanted us to do it in like a year and a half. So,
Yeah, that's one thing I think they've definitely reevaluated that and realized this is definitely going to take some time. I think in our area, my biggest thing, because I care about the people using these services, is when I have somebody waiting 10 hours in an emergency room to be seen by crisis, that's not good either. So, you know, we really want to look at this from a county perspective and decide what do we want for our county, you know, for sure. And so that's why I think the hyper-local meeting went well. At least it got everybody together and got good, like a little dicey there for a little bit, but it's just everybody has their own things that they're worried about, you know, with this, and how is this specifically going to work in our county to make sure that we're utilizing everything to the best we can. So I think it was a good first meeting, and we told them we'll meet again once we do this next region meeting, just to see what their new focus is going to be.
thank you. And I hear that you're going to be at Health Committee too to give us this same presentation. So I'll see you again on Thursday. Okay. Moving on, Cassie Taylor, County Administrator.
Thank you, Chair Schaefer. I have nothing to report to this committee this evening.
Okay. Other business and communication. I believe you were given some information about a stand-up meeting that we will be having for Justice Chair Erickson. Chairman Erickson will probably be there at that point in time, but just some information for you because it was not available prior in time for today's meeting. So we will be having a stand-up meeting prior to the county board meeting for a couple of different topics. So Any questions on that? Okay. Any other business or communication? Okay, our next meeting is Tuesday, September 3rd at 4:30, and then this meeting is then adjourned. Thank you.